Palovarotene 10 mg capsule is a medication used to treat a rare genetic problem called fibrodysplasia ossificans progressiva, FOP. This medication works by reducing the formation of bone in muscles and tendons that can be caused by FOP. Palovarotene belongs to a class of drugs known as retinoids, which are related to vitamin A. The recommended daily dosage of palovarotene 10 mg capsule is as directed by your doctor. It is important to take this medication at the same time every day. It can be taken with or without food, but it is important to be consistent with how you take it. Be sure to follow your doctor's instructions carefully and do not adjust your dosage without consulting them first. It is important to take palovarotene 10 mg capsule exactly as prescribed by your doctor. Do not take more or less of it, and do not take it more often than prescribed. If you miss a dose, take it as soon as you remember, but do not take 2 doses at the same time. If you have any concerns or questions about how to take this medication, be sure to talk to your doctor. Before you start taking palovarotene, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth once daily with food, as directed by your doctor. Swallow the capsules whole, and do not crush or chew them. The dosage will be based on your medical condition, response to treatment, and other medications you may be taking. Make sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For children, the dosage will also be based on weight. This medication can be used for long-term treatment or for short-term attacks. Do not take both chronic and flare treatment at the same time. If you have trouble swallowing the capsule, you can open it and sprinkle its contents onto a teaspoonful of soft food just before taking it. If the mixture spills, make sure to clean it up right away and avoid breathing in the powder from the capsules. Use this medication regularly to get the most benefit from it, and try to take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of side effects. It's important to avoid eating grapefruit or drinking grapefruit juice while using this medication, unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects. Also, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules, as it may harm an unborn baby. Make sure to tell your doctor if you do not get better or if you get worse, including experiencing new flares. Some common side effects of palovarotene 10 mg capsule include headache, bone/joint pain, hair loss, dry mouth, dry eyes, dry lips/skin, or other skin changes. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry eyes, you may use a lubricating eye ointment or tear replacement eye drops, and you can ask your pharmacist for more details on how to do this. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, such as mental/mood changes, such as depression, anxiety, thoughts of suicide, or vision changes, such as blurred/double vision, decreased vision. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. And as always, if you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider for guidance. It's important to note that palovarotene should not be used by pregnant women, as it can cause serious birth defects, miscarriage, or premature birth. If you are able to have children, it is important to use 1 or 2 reliable forms of birth control for at least 1 month before starting palovarotene, during use, and for at least 1 month after the last dose. If you choose to use only one form of birth control, it should be highly effective, such as an intrauterine device, IUD. It's also important to test negative on a pregnancy test before starting treatment, have monthly pregnancy tests during treatment, and 1 month after the last dose. Additionally, it's important to note that this medication may stop normal growth in children, so it's important for your doctor to regularly monitor your child during treatment. If you notice any changes in your child's growth or the way they walk, be sure to notify your doctor immediately. As always, consult with your doctor about the risks and benefits of taking this medication and your birth control options. Before taking Palovarotene, make sure to inform your doctor or pharmacist about any allergies you may have, especially to vitamin A-related drugs or other retinoids. This medication may also contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, mental or mood problems, or bone loss conditions. While taking Palovarotene, it's important to avoid donating blood and to be cautious of sun exposure, as it may make you more sensitive to the sun. Use sunscreen, wear protective clothing, and limit your time in the sun. This medication may also cause vision changes, including decreased night vision, so it's important to avoid driving, using machinery, or any activity that requires clear vision, especially at night. Before undergoing any surgery or dental procedures, make sure to inform your healthcare provider about all the products you are using. It's crucial to note that Palovarotene must not be used during pregnancy, as it may harm an unborn baby. If you are planning to use this medication, discuss with your doctor the use of reliable forms of birth control. Additionally, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules. If you are breastfeeding, it's important to consult your doctor before using this medication, as it is unknown if it passes into breast milk and may pose a risk to the infant. It's important to be aware of potential drug interactions with Palovarotene 10 mg capsules. These interactions can change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and discuss them with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Palovarotene include tetracycline antibiotics, vitamin A, and other retinoid drugs such as acitretin and alitretinoin. It's also important to note that other medications can affect the removal of Palovarotene from your body, which may impact how the medication works. Examples of these medications include azole antifungals like ketoconazole and itraconazole, macrolide antibiotics like clarithromycin, rifamycins like rifampin, and St. John's wort, among others. Always consult with your doctor or pharmacist to ensure the safe and effective use of Palovarotene. Remember to take your medication as directed and at the recommended times for the best results. If you suspect an overdose or serious symptoms such as passing out or trouble breathing, it is important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. Before starting the medication and while taking it, you may need to undergo lab and/or medical tests, such as X-rays, height measurement, and liver/kidney function tests. It's essential to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose of Palovarotene 10 mg capsule, take it as soon as you remember unless it has been more than 6 hours since your regular dosing time. If this is the case, then just skip the missed dose and take your next dose at the usual time. It's important not to take a double dose to make up for the missed one. Remember to always follow the prescribed dosage schedule for this medication. When it comes to storing Palovarotene 10 mg capsules, it's important to keep them at room temperature and away from moisture. Be sure to store the blister packages in the original carton to protect them from light, and avoid keeping them in the bathroom. And as with any medication, it's crucial to keep them out of reach of children and pets. When it comes to disposing of the medication, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, be sure to properly discard the product when it's expired or no longer needed. If you're unsure about the best way to do so, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.